I just like to ground really
Yeah, yeah,
before we get started. Okay.
absolutely.
So if perhaps we can just notice where we are in this space and
Hmm.
notice where our breath enters and exits our body and just kind of be with that for a moment and making space for all that have come before us, for those that journey with us,
Hmm.
and for those to come. Noticing a breath again in through our nose, perhaps, and out through our nose or mouth. And just because it feels good to me, I love to exhale out. And then just gently tapping our fingers onto the tops of our legs or wherever our fingers might be, just to bring ourselves back to this space. And then lifting our eyes, taking any type of movements that we might desire, perhaps a sip of water or wine or whatever we choose.
I got some water right here. Thank you for that.
You're welcome. Blessings, everyone. My name is Daphne Fuller, founder of Black Minds Meditation. And today I have the honor of holding space with Miss Candace Oglesby.
Mhm.
Candace is an amazing therapist. She is a practitioner of psychedelic assisted therapy as well as a consultant. And she's also just a practitioner of healing, of facilitating healing, and a phenomenal woman. So, Candace, welcome.
Thank you. Thank you. Thank you. I'm grateful to be here with you. I know we've been planning this for a while, so I'm glad that we are finally here. It's come to fruition.
Yes, yes, it's been a long time coming.
Yeah.
Thank you for understanding the journey and how things work and how life works, and then we still come together aligned again, right?
Absolutely. And I do believe, right, we come together when it's time for us to
Hmm.
come together. So thank you.
Absolutely agreed. So I met Candace through Black Therapist Rock by founder Duran Young. It was an amazing experience. The first time I met Candace, she was giving me this Eartha Kitt vintage, old school, been here before, very elegant
Oh,
vibe. I was like, okay, I don't know this sister, but I'm digging her.
thank you.
Really great experience. Now, Candace, can you tell us the name of your business, please?
It's Jurnee Mental Health Consultant. So Jurnee. I was just talking about this past weekend in terms of the spelling of my consulting. So I'm a huge fan of Jurnee Smollett. Anyone who knows Jurnee Smollett first got her. I feel like her star on Full House. She was Michelle's best friend, Denise Frazier.
Okay.
And then recently, you might know her from HBO's Lovecraft Country. And so I just have such an infatuation for her and just an honoring for her. And so my business is named after her. And
I,
with this idea, we're all on a journey together.
I love how things come together because I was going to ask you to share with us how you came about the spelling of the name for your business.
Hmm. Yeah, it's after Journey Smollett. Yeah.
Another interesting thing, Journey is the name of your business, and you assist with people
Journeys.
on their. Who would have thought it?
Yeah, and I don't believe anything is coincidental, right? We all come to the places in our lives
Mm-hmm.
because of the time and the space that we're in. So I don't believe that this is by happenstance that I ended up in this space doing what it is that I do. But yes, I am certainly helping and supporting folks while they are on their journeys.
Yeah. Can you tell us about the work that you do? I know psychedelic assisted therapy is like really coming to the forefront,
Yeah,
but
yeah.
now the mainstream is really hearing more about it. So, how did you get into this work?
Yeah, so think, as I mentioned before, I don't feel that we stumble across things by coincidence. And so I first heard about psychedelic assisted therapy probably at this point, probably like 4 years. I was in an internal family systems training, and there was a small clip of them showing a veteran doing trials for MDMA. And I was thinking, like, that's interesting, but I don't know about that. It seems pretty intense. I was also, I would say, psychedelic naive. The substance use therapist in me was like, how do people not get addicted on this? And then I was also thinking about the sensitivity when it came to, at least for me, right, Black and brown folks, and the war on drugs, because, this was a white participant. And so I just kind of brushed it off. But fast forward to 3 years, was invited by Duran, who is the CEO founder of Black Therapist Rock, randomly replied to a post on Facebook. And she's like, you're going to come with me to this meeting. And so really didn't know Duran, but I was just like, I'm just going to show up. And, I feel like that was like a divine point in my life for me to even just have the knowledge to show up to something that did not make sense to me at the time. But there was this internal pulling, like, you just need to show up. And I showed up, and things have been continuing to unfold ever since then. And so I've had the unique opportunity, and I will say the privileged opportunity, to be on clinical trials studying the effects of psilocybin, specifically in treatment-resistant depression and cancer patients. And I am now a trainer. I just completed a train-the-trainer program for therapists who also want to be psychedelic assisted therapists. I sit on a diversity and equity and inclusion advisory board for a major mental health pharmaceutical company that facilitates psilocybin assisted therapy. I'm a ketamine assisted therapist. I lead and direct a ketamine program. And I am also a trainer, mental health consultant, where I really try to help support Black and brown therapists or even marginalized therapists to break through into the space, because I know how hard it is.
Yeah.
But also, I just remember my own experience. It was very isolating, and to the point where I didn't even know if I was going to come back or continue. And so I try to support other therapists, preferably who look like me, so that they don't have to go through this experience by themselves. I really give honor to the mentors that stepped up, who said, no, you belong in this space, and we're going to make sure that you don't get lost. We're going to make sure that you don't exit prematurely. And so I've just been helping those who also want to step into this line of work.
Wow. That
Yeah,
is that's a lot. Like,
it is a lot. Yeah.
wow. Just starting from the you first heard about it and you were not really sure about it at all, right?
Hmm.
Then universe came and put it right back in your path.
Yeah. Yeah.
Wow. So there's psilocybin that you said you just became train the trainer for.
Yeah. Yeah.
Okay. And so tell me about that. I know you mentioned a couple of the other ones, but in terms of the psilocybin, is that in pill form?
So it is a synthetic version of psilocybin, because in research clinical trials, you have to know exactly which part of the mushroom that you're giving to participants. And so you can't necessarily do that in its rawest form. So there is a synthetic version that gets created in clinical research trials.
Okay. And it's already been created.
Yeah, it's already been created. You have different pharmaceutical companies that are studying this from a medical research perspective. So these clinical trials are going on. Even just being in Baltimore, we have like 4 hubs right now,
Hmm.
which are doing research on psilocybin. So John Hopkins is known with their research psychedelic center that they have doing clinical trials. There's also Shepherd Pratt, there's the Aquilina Cancer Center, and then I believe NIH is also coming out with their own research around psilocybin if they haven't already done that. So
Okay. And then ketamine is a different medicine,
it is.
and that's
It
already been out.
Yeah. So ketamine is an anesthetic, right? And believe it or not, people who have undergone minor surgeries
Mhm.
have already probably experienced a dose of ketamine or two.
Mhm.
Ketamine was actually discovered in 1960s in Belgium as an anesthetic for animals. And then in 1970, it became FDA approved for human consumption. So ketamine has been around, at least legally, in this way. But I will say that ketamine is not plant-based. But it is associated in the plant, well, not the plant family, but in the psychedelic family because of its properties around disassociation. It's a dissociative change agent.
Okay. And then there's MDMA you mentioned as well. Now, that was the first training you went to?
Well, actually, no. MDMA with MAPS was actually probably the third training that I went to. So my first training was around psilocybin. My second training, I got ketamine trained,
Mhm.
and MDMA was my third training. And then more recently, I just got trained in 5-MeO DMT.
Which I was really excited about when you told me. Yes. Okay. So then there's the MDMA. Now that's not approved yet. Is that correct?
No, so MDMA is slated to become FDA approved in 2023. It is still going through its expanded access
Mhm.
trials. It is proven to be effective in working with folks who have PTSD, but still, again, still in the research phases so that we can really learn from this medicine, but also within the confines of the studies, it has been proven to be effective in working with those who have PTSD.
Now, is this a plant-based medicine?
So it's not. MDMA is a synthetic, very similar to LSD, and so again associated with psychedelics because of its dissociative nature.
Okay. And then there's 5-MeO DMT that you've mentioned.
Yeah.
They just keep rolling in. I'm like, okay.
They do. But I say that these medicines have been around
Mhm.
for millennials, right? When I think about indigenous communities, I think about psilocybin and even iboga, which has its roots in parts of Africa, and then you have ayahuasca, which has its roots in Central America, South America. And so these medicines have been around for forever.
Mhm.
And because of the war on drugs, they are just now making their way back to mainstream. But these medicines have always been available to us. But unfortunately, due to the 1960s and 70s era,
Mhm.
um, these drugs were legalized. Um, and so, well, should I say illegalized? And then are now just becoming decriminalized and legalized.
We spoke on 5-MeO DMT. Now, what's on the market is a synthetic, right? But
Mm-hmm.
there is a natural form that can be found in the Amazon somewhere.
Yeah, so I mean, 5-MeO DMT is basically venom that is taken from the toad.
Mm-hmm.
And so also the reasoning behind the synthetic version of this is just because, these frogs can become in a sense, they are very native to the land. And so we don't want them to become endangered in a sense. So we even have to be mindful in terms of how we approach these living animals, because essentially they are living animals. And so we want to be mindful in terms of the care. And so even as we talk about research, right, it just would not be enough toads, right? And again, we want to respect, I would say, the culture around these living animals and how we take care of these living animals as well.
That is so important.
Yeah.
When we look at capitalism,
Mm-hmm.
look at what's already kind of happened to our country, what's continuing to happen with just the cutting down of the trees. You see
Yeah.
deer in the neighborhood, and then people feel like the deer or the different animals are invading, but no, really, they were here before you got here.
Exactly.
So
Exactly.
that makes perfect sense. Okay.
Yeah.
Now, out of have you had a journey before? Have you experienced a journey?
Yeah, so I will say a good thing about my ketamine training that there was an experiential component where I actually had two routes of administration that I experienced, one being the oral solution, but also another being the intramuscular injection route of administration.
Okay.
Yeah, so in terms of just my experience, I would say that I have had a very profound experience on ketamine, preferably the oral solution. I feel like the intramuscular injection, it's like a matter of a minute or two, and you're like there, versus the oral solution really was a transition. So you're swishing the solution for 20 minutes, and there's just this nice transition process that happens with oral solution. And that felt really nice, not to just be thrown into the experience, but as I like to call it, to be ushered into the experience. But it was during that oral route of administration where I was gaining some clarity around my grandmother at the time, who is still with us, but really just the diagnosis of her Alzheimer's.
Mm-hmm.
And so I feel like that experience, and this wasn't an intention of mine, because we talk about mindset, the set, and the setting. So I went into with some intentions, but that wasn't the intention at all. But I felt like the medicine, combined with my own inner wisdom, just telling me like everything was going to be okay with her. I was very worried about her well-being. And so fast forward to, a year and some change later, she's still here. She's still okay. And of course, she's still struggling with this disease. But I'm still able to cultivate my relationship with her. And so I felt like I was able to gain some peace and some clarity around that in that experience. But also, what a lot of people don't know is that ketamine can also be helpful for pain management. So I had migraine disorder that I had been suffering from for like the previous 3 years. Like, it was so bad that I had a neurologist that I was meeting with every 6 months. And even just how the migraine started, it felt like it was an onset, like just an immediate onset. But I think it had a lot to do with the stress that I was dealing with at work. But once I had it, it's like I couldn't get rid of it. And so just having 2 doses of ketamine, I no longer needed to be on migraine medication. And so I have been off of migraine medication at this point, at least for a year and a half, and haven't had any migraines to the extent in which I had prior to those ketamine experiences. So those are like the really robust experiences and meaningful experiences that I feel like I've had from ketamine. I feel like even if the ketamine didn't do anything else but alleviate those migraines,
Right.
I consider that to be a success.
Right.
So yeah,
Those are some profound experiences. Both of
yeah,
them. Yeah. Thank you for
yeah.
explaining the difference in the oral, and then you said the deep muscle. That's like a
So
shot.
the intramuscular, yeah, it's a shot. It can seem like a roller coaster ride. And again, it's a very fast takeoff. Whereas I feel like with the solution, which is also known as the troche lozenge, that essentially dissolves into a solution, felt very soft in how it transitioned me into the experience. And just even just the whole 20 minutes of swishing, like there's so much like ceremonial work that can be done before that, like grounding and breathing, which just really feels nice for my system, when having those experiences. So
Okay. Yeah, and that was going to be one of my next questions. I know you said something about intentions, and then you went on to talk
mm-hmm.
about being a ceremonial experience. What would you recommend for someone who's this is, I wouldn't even say their first time, but them journeying? What are some things that you would recommend as far as preparation is concerned?
Yeah, so getting real clear around what those intentions are. And intentions are really the tone for what is it that I want to experience in my journey itself, right? And it could be, setting intention around, say, even mental health symptoms that maybe I want to get more clear on, like, what is the root of my anxiety? Um, can I maybe sit next to that anxiety? maybe the intention is that I'm more patient with myself, right? When I'm anxious. And it could just be anything that say the person wants to work through, but we do say with those intentions to hold them loosely, because we believe that whatever comes up in the experience is what is necessary for that person's healing. So even when I am sitting with folks and doing preparation for their ketamine sessions, we spend about a great deal of time supporting and helping folks get clear about what is it that they want to work through, what is it that they want to work on, and really being clear on that. And I think it's important that folks feel empowered around the intentions that they set for themselves in this experience.
Yeah.
Also, just in terms of, music, right? Music can be so supportive in this space. And even as we talk about music, music is known as the silent therapist in this space. So even whether you're going to do a session with live music, because I know that people have done that where, people bring in their own instruments to be able to have sessions with, or collaborating with who you're sitting with around what that playlist should look like, because I think that that should be meaningful, but I think it should also be a nice kind of like collaborative partnership between the music and the person. And again, this music is nonverbal in nature. There's a lot of instrumentals that can be used, but again, I think it should be unique to the person. Even a unique item, I tell my or I invite my participants to think about maybe a unique item that they want to have in the space. And so I've had clients bring in pictures. I've had clients wear like a piece of jewelry that was very symbolic to them, which again can also help folks kind of stay grounded in the moment to see their unique item from across the room, or even just, man, if I can place my hand on my chest, it feels nice to be able to have this thing that, I've worn that is extremely important to me to kind of hold on to during the experience itself. I think the biggest thing, identifying like who is the person that's going to sit with you, because we know that not everybody who proclaims themselves to be a healer in this space is a healer.
Right.
And so I think that that is the biggest challenge, is that, unfortunately, people don't know like what to expect when looking for a healer, or even looking for like a psychedelic assisted therapist. And so one of the things that I invite folks to be asking, right, is the person trauma informed? How long have they been doing this? Are they in a recovery process themselves? What is their stance on touch in this space? Just because we do know that sexual assaults do happen. So that also needs to be discussed beforehand. How are we going to talk about safe touch versus therapeutic touch? Because there is a difference between, someone having difficulty and may reach out for my hand for a therapeutic touch versus someone beginning to self-harm themselves in a session, or they're in a situation, right, where there might be a safety concern and I might need to hold on to them to maybe escort them to the bathroom, whatever the case may be. But interpersonal grounding, known as touch, should also be discussed beforehand. So those are just some things that I'm thinking about at the top of my head that should be have an in-depth conversation about. And if you find that the person is becoming impatient, or they're stating that you don't need to have conversations about this, then I would encourage that you run because that is not, someone that you want to be sitting with in a very tender and vulnerable experience. But also, do they do integration, right? Because it's not so much just taking the medicine itself. We see the medicine as a tool, but can someone really help you make meaning of this experience when you come out of that? And we do know that integration can happen over the course of weeks, months, and even years.
Okay. And gosh, you are dropping so many gems. So I want to ask you to share with everyone what integration means. I know
Yes.
people that don't, but prior to that, you were talking about a number of things that you recommend people know about or questions to ask. That was very important. Where can
Yeah.
you find this information? Is this on your website or is this something you provide?
Yeah, so I do offer folks to do consultation with me. I actually just started doing just in my private practice preparation and integration with folks, just because the reality is that the general public doesn't know that these are questions, these are things that they need to be considering, even for folks who go to like ketamine clinics just to get dosing, right? And there's a difference between ketamine infusion versus ketamine assisted therapy. So there are a lot of ketamine infusion clinics where anesthesiologists or a psychiatrist comes in and provides a person a dose. But unfortunately, you hear stories about how folks get sit in rooms by themselves for an hour, 2 hours, and they're having these very tough experiences. And for some folks, it can be traumatizing or re-traumatizing. So even just this idea, like asking, like, yeah, can I have someone sit in the room with me? You hear folks who don't even get like a blindfold or even like headphones for their music. Um, Again, people don't even know that these are the things that they should be asking. But I do consultation with folks who are receiving either ketamine experiences out in the community, or for folks who are having underground experiences. I do preparation and integration with them because there's a lot that people don't even know that they should be asking. And this does come from, my experience in being in clinical research, because we take a lot of safety precautions and making sure that the medicine experience itself is safe. And even just like as a trauma informed therapist myself, I have a sensitivity and making sure that the safe container is established, because I have had so many folks come to me with traumatic experiences that there's just this extra layer of safety and sensitivity that I come with, ensuring that people have not just the most meaningful and robust experiences, but also that they have safe experiences as well.
Yes, safe experiences. Safe. I know we've had a few conversations about this in the past. So very important.
Yeah. And I think especially when we talk about black and brown lives,
Yeah.
um, even when I think about, you know, from the war on drugs, right? And from a harm reduction perspective, there are still states and federally, right, that are criminalizing folks, for substance use. And so, even though these medicines can be very helpful, they can allow people meaningful experiences. Even still, how we go about, supporting Black and Brown folks and doing this, there has to be some safety around this. And I'm even thinking about just our bodies as Black people, making sure that we feel safe. And even from a research perspective, when I think about US history and Black and Brown bodies when it comes to medical research, a lot has been done against our will. So much so that, even folks who have gone through, I think about, certain research institutions and how these families are still not receiving reciprocity, for their loved ones
Hmm.
and the research. That has not been helpful, that has been more harmful in general. So I'm also thinking about that, from that perspective, in terms of safety, making sure that specifically Black and brown folks who do this are able to come to this work in an authentic way, but also that they feel safe in doing this.
Yeah. So I know I asked about integration.
Yes,
Tell me
yes.
a little about that, what that means.
Yeah, so integration can be really helpful with the medicine experience, and integration really helps folks to make meaning of their experience, but it also helps for just to continue to explore in depth around what this experience was like for some. Because I think with, right, even the hype, Michael Pollan's Netflix documentary that just came out, How to Change Your Mind, I think people are coming to this. This is going to be almost like a magical experience, right? And this is going to be something that takes my depression away or my anxiety away. But in fact, not everybody comes out having a very meaningful and robust experience. Sometimes these experiences can be very disappointing, especially if expectations and intentions are not met, but there's still something that can be gained from that. But I think that's why it's important to have someone who is trained in integration to kind of help that person deal with if there is disappointment. But also, right, not all of our experiences are going to be contextual in nature. A lot of times people have physiological experiences where their experience is somatic in nature. It's not necessarily information in nature. And so even just having someone who is versed in doing body work, somatic work, to be able to help that person integrate again is important, because you often hear, folks talk about they don't necessarily have the words or the language to put that to their experience. So how do we help assist and support people getting more in tune with their body, even doing integrative process? And even I know people are starting to use music as a form of integration. People use art as a form of integration. I remember a psychiatrist was telling me that he was working with someone and it wasn't so much language that came up for them, but they were able to paint and draw, which really helped to integrate their experience. So I think it's also important too that when we talk about integration, that people are well versed on different ideas of what integration can look like, because it's not always verbal in nature.
Beautiful. Thank you for dropping another jewel.
Yeah,
Yeah, I didn't
yeah.
think about I love that because it feels outside of the box for me, and I'm an outside of the box. There's more
Hmm.
than one way to heal type of person.
Yeah,
So
yeah,
giving someone the opportunity within that experience to be creative, because so much creativity can come from these experiences.
yeah, yeah. And even movement. I started encouraging my folks, if they were having more of a somatic experience that they needed to integrate. There was an acupressurist that I was also sending my folks to. This was someone who had gone through some psychedelic training, was very well versed, in this. And so even using movement as a means of integrating can also be helpful as well. And I think also, right, I just think about the cultural nuances, right? Not everybody processes the same way, right? Everybody's integration process can look different. And so I think that we have to be available to folks when their integration doesn't necessarily look like talk therapy, right? It may need to look like some other form of integration.
Yeah. As you were talking, I was thinking about the difference between psychedelic assisted therapy and someone having a journey on their own.
Mm-hmm.
I'm sure that there are tons of people that have had them on their own and they've been great, and
Yeah,
then some
absolutely.
not. hmm And then
Yeah.
go ahead.
Mhm.
I apologize.
No, go ahead. No, 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 no. Go ahead.
And then there's on the psychedelic assisted side the same thing. Some good and some perhaps not what expected, as you mentioned
Hmm.
before. I'm just thinking about the difference though between having a journey where you actually have someone there with you when something challenging comes up or if something challenging comes up
Yeah.
versus being in a space where you're taking the medicine and you would benefit from having someone there to help you process some of these things and not having that, or being with other people that don't have the capacity
Mm.
or the skills that could potentially re-trigger.
Yeah. I mean, I always say for folks who are new to this and have not been doing this for a while, that I think it's always in the best interest to have someone that they trust being in the space with them, at least just to hold space, right? Even if they don't do anything else,
Mm.
just to kind of hold space, ensuring that they don't walk out the door or elope, right? Because I have heard of stories. I heard of one person, you know, was doing this recreationally, right, which a lot of people do, but ended up walking out of the house into the street, right, and just had no understanding of what was happening at that time. And I'm thinking, like, man, like that could have been such a different outcome if this person maybe had someone present there that they trusted just to kind of help distract them, but also maybe even just help them to calm and relax a bit. And so even like when I'm thinking about my own clients, how much preparation I do around breathing techniques, imagery, and mindfulness, because I want to be able to empower my clients to be able to go through their experiences. But we got to give people tools to go into their experience. And so I think that's also another thing that we miss in this space is that, again, it's the assumption that the medicine is going to be doing all the work, but it's you, the person, in collaboration with the medicine. And we have to be active participants in that process. It's not like we take the medicine, we step back, and the medicine does the work for us. No, we are very much active participants in this process. And we also have to be doing work. But people also need to be aware of the tools available to them so that they can be successful in having these internal experiences, but also having the most meaningful and robust experiences they can have. So I don't think it's never a bad idea to have someone there that a person trusts, that can be a safe space for them. And even I know people who've been doing this for a long time and have talked about, still just needing, it's always nice just to have someone present. But I'm also thinking about the collective piece too, how rich it can be to be in a space doing this work with other people and community, but there has to be some ground rules and some boundaries set around what is appropriate and what's not appropriate in this space when people are journeying together. But again, I think that comes from having, I would say, an advanced healer, someone, again, who's been doing this for a while, or even a therapist underground or therapist above ground, to be able to make sure that these things are talked about in preparation around what's acceptable and what's not acceptable before people go into their medicine experiences.
Okay. In terms of accessibility, is this accessible to Black and Brown bodies?
Well, I think it depends on what you mean by accessible, right?
Yes, that is true. How accessible is it? What would a
Yeah.
person need to do? What would they need to have in order to have access?
Yeah. And so again, right, ketamine clinics are popping up left and right.
Yes, they
But from my understanding, a lot of these clinics do not provide ketamine assisted therapy. And so also another accessibility question is that a lot of insurance companies do not cover ketamine, even to this day. And there are certain types of routes of administration that they will cover. But again, how accessible is this to folks in a safe way? And so when we talk about oral troche lozenge, these troches are about $40 to $60, but you would need to have a prescriber who's able to prescribe this. But also, again, working with someone who knows what they're doing around preparation and integration. And so, again, in terms of education, a lot of folks don't even know that this is a type of modality
Mhm.
out here. And so I think education is important to educate folks on what their options are, because I think there's also a difference too between the Black and Brown person that lives in an inner city, right, where there may be more options in terms of locating someone who is more skilled, more knowledgeable, versus someone who might live in a rural part of, town where there might not be a lot of education. There might not be hardly or if anyone doing this type of therapy, but then also to people's financial means to this type of therapy. Because even when I look at ketamine assisted therapy, as far as how much therapists are charging for their time, because again, insurance doesn't necessarily pay for this, you're talking about it can be upwards of $5,000 for a round of treatment. And a round of treatment can look like between 4 to 6 sessions. That's not including the maintenance that sometimes people will need. And so I think people, again, right, need to be able to exercise their autonomy in this choice around this, whether they want to just be on ketamine solely, which is quite all right, just like people who prefer to take psychotropic medication without the therapy. Or right, people understanding that, no, if I'm going to be doing this, I want to be working with an experienced individual. Just know that you're going to be paying for that experienced individual's time. And that can get pretty costly. So I think that, certainly even when we're talking about accessibility, we have to talk about, what are people's needs and their desires in this space. But again, people need to be able to make informed decisions around their treatment, and knowing what all of their options are. And I do know some places that do offer payment plans and things like that, or sliding scale fee, to work with marginalized folks who might not have the means. But again, people don't even know that these are the questions that they should even be asking about this modality of treatment.
I'm not a huge medicine proponent. I know, I've kind of mentioned that to
Yeah.
before. So I'm always kind of like a little leery when I start even thinking about what would they even need to do in order to make it less expensive or make it accessible.
Yeah. And I mean, there's been a lot of conversation of the purpose of group protocols too, to
Okay.
make this more accessible for folks, because when you're able to be in a group, right, that lessens the cost for each person, because you're not having to pay that individual time, but the time is broken down into maybe having like 2 or 3 people doing this work at the same time, which can be very beneficial, right, for the person that can be in a group experience. But not everybody feels safe, right, and comfortable in a group experience, and may have to work their way up to that point. And I do just want to say, right, why we keep talking about ketamine really versus maybe some of the other substances is because ketamine is the only FDA legally approved, I would say, right, psychedelic at this point in time.
Okay. Thank you.
Yeah.
That was a good catch. I thought about it and I'm like, well, I knew, but other
Yeah.
people might not know. Makes
Because we've talked about some of the other substances, right? But unfortunately, these other substances are not legalized federally, and not FDA approved outside of clinical trial research. So I will say Oregon is the only state right now legally approved to have psilocybin, as they just launched an initiative um, to be able to explore psilocybin from a mental health treatment perspective. I feel like that's also going to be some pressure riding on Oregon, just to kind of see how they do with this mental health initiative, with legalizing psilocybin for this particular protocol and program, which I'm hoping will influence some other states to legalize this as part of an initiative for a certain period of time, helping to kind of again explore different modalities in regards to mental health treatment. So, yeah.
Is there anything that we have not discussed yet that you feel is important for folks to know?
Yeah, I'm just thinking about the therapists who might be watching this, that might be, and I get this question all the time, like, how do I break through into this space?
Mm-hmm.
One of the things that Duran has always asked me every time I've met with her is, what do you want out of the space? Like, what do you want to be doing in this space? And so I invite folks, to do their research, get education on this, but also really just getting clear, like, what is it that you want to be doing in this space? Whether it's, I want to be able to provide this type of treatment to my clients at some point in time. Or maybe it's, hey, I want to maybe at least start with finding a prescriber that I can possibly work with to begin prescribing ketamine and doing ketamine assisted psychotherapy for folks. But really be thinking about what type of medicine you want to be working with, but also how do you want to show up in this space as a therapist, doing as much research. And I will say, Google is our friend. There is so much information on the internet. And I get that, right? We might need help deciphering, right, which information we should be following. But just start with an initial research, and just a search of these different types of medicines. There are so many collectives out here. I know there's the Chacruna Institute that is specifically talking about accessibility and how do we make this available to all people, not just a select few people. There's also Black People Trip, is also another organization that supports getting folks educated on helping Black and Brown people in this space. I know for me, I have gotten very clear on what it is that I want to do in this space. And that's really to bring more of this to marginalized communities. But I am also an advocate that therapists who represent these marginalized communities need to be providing the type of treatment, but also who need to be training these therapists as well. So we need trainers who look like us. We need therapists who look like us to better serve our communities who look like us. And that can be any type of marginalized community or population, from LGBTQ to Black and Brown folks, to neurodivergent folks, to able-bodied folks, but anyone who just culturally looks different.
Thank you, Candace.
Yeah.
I can feel your passion, not just really, I can feel it. Like
Thank
it's
you.
all over you.
Yeah, I mean, I feel like that is what I'm fueled by. I feel like this, I would say this community has not just literally changed the trajectory of my career, but it has also infiltrated my personal. I feel like everything about my life has been kind of shaken upside down, but in a good way.
Okay.
And has really just helped me to redefine why am I a therapist in the first place? Why am I doing this? Who am I helping along the way? And yeah, what is it that I want to continue to do in this space that's going to make an impact? So I appreciate you saying that, Daphne, because I do want my passion to fuel me. I want to be able to show up in this space as my authentic self. And I want people to be able to recognize that when I step into a room. So thank you.
You're welcome. Candace for president. I'm just saying. I knew it when I first saw you. You had on like a red hat or something. I think it was like a red
Maybe.
turban. It was so cute. It was so cute.
Yeah, it was a red turban. Ah.
I remember. I don't always remember things, but
Yeah.
that's like etched in my. I was like, who is this? Super dope sister. Okay. So, where can people find you?
Yes. So www dot Jurnee Jurnee with Candace Candace.com. And I have my calendar up there. So people just sometimes just book a 15-minute discovery call with me. You don't have to feel any pressure to sign up for any consultation services, but I'll talk to as many people as I can about this work, because again, I am passionate about it. And some really, I will just say, some amazing people offered their time without any sort of reciprocity, to make sure that I stayed in this space. And so, I want to do everything I can to support, Black and Brown folks, specifically from a therapist perspective, how they can get in this space, but also how we retain these folks too is important.
Okay. Thank you so much. Thanks everyone for joining us.
Thank
Please
you.
make sure that you like, that you share. Contact Candace if you have any questions. Also follow us on Instagram, or you can find us
Mm-hmm.
at www.blackmindsandmeditation.com. Take care.
Bye bye.